Got it?
The power.
Excellent.
Sorry.
Hi, everybody.
Oh my God, don't.
It's Matt Dyan. Welcome back to OK Aussie.
These are awesome.
They are very awesome.
They're awesome.
Stimming toys for autistics.
done
For anyone who's
engineering.
neurodiverse. Anyway, welcome back to the channel. If you're new, hello.
Hi.
Don't forget to subscribe and hit the notification bell.
Look
We've
at
got...
me. I'm a new person.
You actually should be feeling like that.
Good day, although...
Quick touch.
Hang on, hang
touch
on.
wood when you say that, young lady.
In the sense of I've showered.
Yeah.
Washed my hair.
You feel
Look,
human
I do
again.
bath in between that and bed bath. I'm just saying I showered.
Yeah.
But I'm not going to lie. For a long time after the shower, it was beeping.
You mean
beeping,
this? Your
beeping,
pulse
beeping.
oximeter was going off the charts because you're tachycardic. Yes.
I'm not good, but I'm good.
Okay, well, she's good, but she's not good. Well, I'm glad that you're here, and I'm glad that you're here because we're going to have a conversation about pain management very, very specifically today. A bit of a social story.
We do this off camera, and he said, let's do it on camera. And I said,
Let's
yes.
show the process because we're getting ready for a clinic appointment.
This is what we do for clinic appointments, doctor appointments.
Yeah. Now, before you do that, do you want to show them the outfit of the day of what you're wearing?
Yes, I want to show you my Peter
let's have a
Alexander
look.
short. No, these are my pink ones.
From
Check what your mama gave you.
Peter Alexander.
Peter Alexander.
Yeah.
I don't know how to model at all. I got
nailing it,
these
honey.
ones, they were 19, and I got another pair which were kind of a linen with a white stripe, and it's kind of a tanny brown.
Massive sales at Peter
so it's
Alexander.
kind of a natural. I love the natural colours because of my brown hair, brown eyes.
Yeah.
But yeah, so I got 2 pairs for $19.
Fantastic. And what's the top that you're wearing?
This is buttery soft.
Buttery
This is from
soft
Shein.
from Shein. Very surfy.
Didn't
And I
like
love
it,
your
guys.
headband
So it's
as well.
Nice blue. I thought it goes, baby blue, baby pink. Nice. Well, my hair's wet, so I just put this on.
Right, so you're back in bed ready.
Shut up. It's noisy.
All right. Got
It
you
is
together?
noisy. Like that was quite loud.
It is
Anyway,
for you. I get it.
I have to concentrate,
Yeah,
guys.
because-
Processing problems.
Processing problems.
Is that it?
Yes, it is actually.
Yes. Okay.
Funny enough about that, it does actually affect your auditory processing and you've got a sensory overload. Now, what are we doing? We're doing a bit of a social story. We're doing a bit of a refresh and a
Get my
recap
diary.
for them. You've got a diary.
I have to. I'm
You're
a
gonna write
writing
key
person.
points.
I don't use my phone. Don't like it. Blind. Can't see it. Need to write big. And I love a big book. Even though I don't have much life. Very medical. But this helps executive functioning. Look, it fails for me sometimes because I forget that I even have a diary to pick up and go, oh, what? And I forget the day and the date. But anyway, it's better than nothing.
It is better than nothing.
I'm trying.
Any strategy, any
I want to be
technique
independent.
that helps you to be independent and also to help facilitate you to be as functional as you can, then
So satisfying.
fantastic. Great. Now, if you're new to the channel, Dyan does have an umbrella condition.
To get me in trouble.
22q 11.2 deletion syndrome. It's a genetic chromosomal disorder. Okay, she's missing between 30 to 50 genes, 3 million DNA building blocks, and it affects anywhere up to 185 clinical symptoms. Now, that's going to be the catalyst to why we're having this conversation. Tomorrow, you got the first of the specialist appointments for 2026. You've got about 25 different medical
I
allied
don't let
health
them see
specialists.
me in December. I'm like, no, I'm not on holiday because I'm poor. I'm not available.
You're not available.
Bye.
Okay.
I'm booked out with...
medications.
Okay, so that was Google Home Automation.
We have that rule, don't we?
We do.
December and early January. It's like booked out.
Right.
Not on holiday, just booked out.
Well, it does actually wear you down when
Yes.
you have so many
It's depressing at
specialists, so
Christmas
many
and New
appointments.
Year. I don't want to go there.
We have to
I go there all
also
year.
balance the risks because in summer, which is for us in Australia, in Perth, Western Australia,
It's like
that
Christmas.
summer period is where it's the hottest. It's getting up to 40 degrees Celsius, and that's the most risk point for Dyan, as you've seen on the channel, neurologically, for seizures, dystonia, and everything else going
Because
on.
if I have a seizure in the clinics, then I have to be taken to ED.
Yep, it's an abort. You got to go straight to the ED.
Code blue, I don't know.
Code blue, and we miss out on that appointment. We could be waiting for that appointment for anywhere up to a year and a half just to get to that appointment.
Either.
They
So,
don't. Yeah.
fix
Now,
your system, stupid.
You've just had Google Home Automation tell you something,
Yeah,
yes?
right. So,
I
we
know
are...
it's easily distracted with the ADHD.
What day are we?
What day are we?
Sunday.
Sunday. And this is?
This is Sunday.
Afternoon.
We're in the heart.
Ooh.
Sunday.
Let's actually, before we do that, check one thing. What's the one thing that I should check before you take the medications for lunchtime?
A Panadol.
Panadol. So what do I have to check?
Oh, my temperature.
Your temperature. Okay. So
Can
we're
I
just going to
just,
check
can I
that.
just clean the nozzle?
No.
Yes.
No, I've done
Gibby,
that already.
gibby, gibby.
No, it's okay.
OCD.
I've replaced it already.
No, I've done all this cleaning.
No. Okay. Your OCD's a little bit high.
I cleaned my ears and you're about to put that in. Let me clean it. Just a little.
Okay.
I can't afford the plastic bits to be changed
We do
every
change
time.
the plastic bits.
But we do change
And I do
it.
use the alcohol wipes to actually sanitize. It is a single use for only one person, which is you. Now,
But my
why?
ears are an oil company.
Okay. Probably you
True.
should, yeah,
I've
check
had a
that.
shower and I've got wet hair. It's probably nice. My temperature's probably good.
Sure.
What? It's 23 degrees in here.
You know what? Your temperature is actually not too bad. It's 37.3 degrees. Now, we know that by the afternoon it's going to continue to increase. It has just gone lunchtime, so don't take the Panadol, put it back into the capsule, and we'll keep it there in case we need it later in the
So
afternoon.
that's the Panadol.
That's the Panadol. Correct, Panadol Austria 665. We hit a
Everything
threshold
else.
where
Alright,
Dyan
furosemide breaks.
might be febrile, so at 37.5 and above, she takes the Panadol Austria to bring it down. You're
Stop.
saying about furosemide.
Yeah, like if I
What's going
need
on?
breaks, you're going to have to
Of
like...
course, no worries.
Sorry guys, but
Easy
you
peasy.
won't feel the break, but can I have the fluid?
And here is your V8
Alright, I'm going to
Super
take
Juice.
all the little ones together.
Okay.
That's a good thing about a high palate pressure. Woof!
Yes.
And dysphagia.
Yeah, there are a lot of
This goes down.
medications,
This
seizure,
goes down.
seizure medications that Dyan has to take, antibiotics that Dyan has to take, gut health that she has to actually take,
Except I
like
can't eat
probiotics,
burgers like other people.
antibacterials that she has to take, like urine as an example, vitamins A, B,
Hard.
C, D, E, F. Jesus, you got the whole alphabet going on. You got the musical
what I
alphabet.
said to
You need to
you.
start at the very beginning, like do, re,
Now
mi.
realising there's an alphabet pattern to do with these
Yeah.
tablets.
A lot of
Might as well take them all.
supplementation. Now, a lot of autistics are actually missing or don't have the ability to keep hold of.
It's called pyrroles.
Yeah, or pyrolia.
You get your wee frozen.
Okay, you probably should explain
Yeah.
these things a little bit better. When you're having the
Literally
tests
right
done,
in front of you, like
they freeze it
spoons
to be
and
able
stuff.
to
They
ship
put
it off
in
to
these
America
little
to get it tested.
space-looking things, and they just lower it down, and you see the white
Cryogenic,
smoke. And it's
frozen.
like, whoa!
She got so
and she
excited.
goes, "It's cool, isn't it?" I'm like, "Yeah."
Literally cool. Actually, it is very cool. I love those little
She must
jokes.
have loved me.
Yeah.
She must have laughed at me.
Yeah.
And she wrapped my wee. You know, you get the same little yellow cap thing. I've peeled
Yeah.
many of them.
Specimen jar, honey. Yep. Right.
Anyway,
We're
she
gonna have
wrapped
some
it in
stories today.
alfoil.
Yeah.
I'm just like, and she puts it in this thing, and then she lowers it down,
Lowers
and she
it down.
closes the lid and closes. I'm
Yeah.
just like, whoa. She goes, "It's going to Melbourne." It's my wee's going to Melbourne.
Honey, most of your DNA has
my blood went to
transversed.
Sydney.
Yeah.
I got Lyme disease.
And
It's like,
Queensland.
this is crazy.
And the UK.
Oh yeah.
And America.
Yeah.
You've got DNA all over the shop for
Melbourne,
testing.
my DNA went to Melbourne.
Multiple
for
universities
the
are testing you.
genetic seizures too.
Yeah, I know, right?
Jeez.
Anyway, we could be here for 3.5 hours. I'd like to try and
I
focus in on this conversation.
I wish
if
there
we
wasn't
can.
the internet and stuff, because they'd have to fly me there,
Yeah.
and I'd get a like cool stay somewhere.
My apologies in advance. Dyan is a little bit Tourette'sy this morning already.
Sorry.
Whilst I was at the gym and I was monitoring her safely whilst I was down at the gym
What
on the
was I
treadmill
doing?
on the external camera, a lot of ticking, a lot of motor ticking. I've also noticed that obviously pulse oximeter readings, the heart rate, very, very tachycardia, and oxygen drops have been happening. So if we have to stop halfway through this, my
Sunday
apologies.
18.
But what the reason we're doing this for is to help prepare Dyan to bring together a lot of compartmentalised, separate batches of information throughout the course of last year, so that Dyan is refreshed with the knowledge and the information when she's about to step
'Cause they
into
need
the
to be-
hour-long consultation, so that you already know a lot of the simple answers. You don't have to ask the simple things.
Yeah.
And that you've also got a purpose. If I was to bring this down
Yeah, you don't want to waste the
to
appointment.
10 words or less, the goal of the
I'm
appointment
not
would
good
be
at that.
saying, "I'm in pain. Can you help me, please?"
Is that what I
Daily.
have to
Well,
say?
no, you don't have to say that, but if you're really thinking of a basic summary,
I
every
know.
day you're in pain and you want help. Isn't that the
Agony
basis?
every day.
Okay.
Am I allowed to say that?
Yes, you can. So, I'm in agony with pain daily.
Yeah.
Help me, please. Would that be the basic summary of what you're looking for?
Yeah.
Okay,
Yeah,
cool.
absolutely.
All right, so we've got a very top level. Let's call that the executive
Okay,
summary.
So what
That's what
time
we're trying to
is
achieve.
this on
Okay, so for
what
your
day?
calendar, helping with executive functioning, preparation, getting the mind into place.
What day?
Scheduling is really important, okay? And it is on a Monday.
19th.
Monday the 19th of January.
Monday,
yep, correct.
So
and it's at
pain
12
clinic.
p.m. Yep, it's the
So
pain
put it in
clinic.
the middle of the page then.
So this is an
So
outpatient pain clinic
12
appointment.
Noon.
Right, put it in the middle. Great, 12 noon.
At what time?
That's 12 noon. That's what you just said.
Oh.
Yep, 12 noon. Middle of the day.
Pain clinic then. Oh, that was a faux
Yeah.
I can't even write on the lines. I'm so blind.
You don't have to. That's okay as well.
This is my new 2026 diary.
You know what? The
Anyway.
vitamin A is going to help you with your eyesight, but that's another story.
Ooh.
Do you know what the format of this pain clinic appointment
Is
is
that
in?
all I need to write?
Yes, it is. Because I can't give
I'll
you
leave it there for notes just in case
Yeah.
I
So this
there's
is with
a
a
complex question.
specialist doctor who is
Right,
a
they're a-
pain consultant. So
they're
the
a
type
pain
of doctor is
consultant.
it's not a registrar. He is a consultant, and he
So
is
he's
a
just
specialist.
like a GP for pain.
No, actually not.
A specialist for pain.
Yeah, he's a specialist, and they call themselves a consultant, and they specialise in pain. That's what they do, day in and day out. They also go into places like the ED and other clinics, and they treat the staff and teach the staff how to
what someone might
understand pain,
for what
different
they're
types
going
of
through.
acute
There's
and
different
chronic
types of
pain,
pain.
absolutely, and options around pain
Yeah.
management. Okay, so I can't tell you the name of the doctor because we don't know. Sorry, we'll be
So it
assigned.
could be a male, female.
Could be a male or a female. Yep, so these are the unknown variables.
I prefer a
Could
male.
be young or old.
Women just.
Most of the ones I've heard of so far are actually male, so it most likely will be a male. But we
Women
can't
are
control
more
that variable.
confusing with their communication.
Okay.
No offense, neurotypical women.
Now, if you're having problems, because this is a video telehealth
I
appointment,
hate that.
right? But you at least don't have to be dragged in. So a lot of your energy is
Yeah.
not going to be taken
That's
up
the
by
good bit.
getting up, getting dressed, driving, getting a car
Because if I
park,
do
wheelchair
have
in,
energy,
waiting
I'd
in
rather
the
have fun.
clinic, and then going into the actual appointment. This is going to conserve a lot of your energy so you can focus, which is really important. Okay, so it's a good accommodation to allow for you to be able to perform your best in this appointment.
Yes.
If you don't understand during the appointment, what can you say? What would you like them to do?
What I've said in the past is things like, I don't understand
Okay, simple. I don't understand what you've just said.
what's going on.
Okay, well, what's going on?
Like when you guys talk, or
Okay.
you know, and it's a bit like at university, the lecturer used to always say, "Are you still all on the train?" It's a bit like that. People
Okay.
fall off the train
All right.
as the conversation gets more and more deep, and I do fall off the
Right.
train. So I
So-
sometimes will interrupt and say, "Hey, I don't know what's going on."
No problem.
It always happens.
Now, on and
The pressure's on me.
at the hospital, they are acutely aware, they've been advised that you have special needs for accommodations.
Yes, that
because
helps.
of having initially GDD, global developmental delays, IDD, intellectual developmental delays, you've got
They need to-
communication difficulties. Sometimes you are selective mute and you need to use an AAC, augmented alternative
Just
communication
some of them are
device.
impatient.
Sometimes
mean.
you have difficulty cognitively because of your neurological condition, so you can go offline. You have aphasia, difficulty with word finding,
that's what's
stuttering,
scary,
slurring.
if I'm missing
Okay, and
anything.
comprehension can be lost with your executive functioning. And as you saw in yesterday's episode, time slows down. So for you lose sometimes time, and ADHD and Autistics do that anyway.
Also-
but neurologically has an impact. What we're going to ask them to do is slow things down. The clinic and the
What
hospital
if
knows
they get
to.
frustrated?
Okay,
at
so we're going
me
to slow
and
this down now. The clinic is already aware that they need to give you more time to slow information down,
Yeah.
to give one instruction.
What if they're
at
like a
time,
nasty
to
person?
simplify the language and also provide diagrams if need be. Okay, so that's what they should do. Now, it doesn't mean it will happen, but I'll help to facilitate that. And I'll say, look, maybe Dyan's not understanding what you've just said. Could we rephrase that? Reframe
Yeah,
it
that
in a
would
different
help.
way. Use
Yeah,
different
I like
language. Do you have a
clarifications.
diagram to show? Okay, that sort of thing.
Oh yeah,
Clarification.
I can ask for diagrams.
You can ask for diagrams. Okay. Now,
That's what the geneticist told me.
you just brought up, and remember too, with 22q, there is a fear and then there's an anxiety that comes
I
with
will
the
be
condition.
anxious.
A lot of autistics are already
The
anxious.
doctors always intimidate me because they do that to everyone.
Okay.
They do that
Sure. So
to everyone.
because we're doing a social story
kind
right
of a
now, we're going to
game.
address that because there is a medical PTSD. What's PTSD, Dyan?
Post-traumatic stress disorder.
And if you have it as CPTSD, what does that mean?
Complex post-traumatic
Because it's not just one thing, one singular instance, disorder, it's
stress
a multitude.
disorder.
You've had a lot of stress and
because like medical
thousands of medical appointments.
like traumatic things.
Yeah, and there's a lot of things around that, but don't make it really much fun. A lot of autistics don't want to go towards healthcare.
No.
I can understand that. Maybe when I was abscond, you might be pathological demand avoidance.
I know, I might go totally quiet.
Okay.
Because it's like,
and I will notice that. So you just asked the question, what if? What if he's mean or nasty or rude?
Yeah, when that happens, I have to shut up because my autism just wants to say, you're being a very rude man, stop it.
Okay.
But I can't do that because they're in a position of power.
Okay.
And in the past, when I've sort of been assertive, they actually get really like mad.
Okay. What if
And then I get really scared.
What if I give you the permission to say, you can say that? And you know what's going to happen? I'm also going to help you, protect you and defend you. So if you are feeling intimidated, but the person's maybe being a little bit aggressive, maybe not listening to you.
Yeah, I don't like
We're going to say,
when they raise their
stop.
voice and they're a man.
Okay, then we're going to
that.
maybe actually work through in that moment. We're going to say, look, I need to stop this appointment right here for the moment. I think we need to address something. Dyan's shutting down. There might be an issue. Let's work out what that issue is. Dyan, I'm going to ask you in the moment, is there an issue? And is there something which we can do to help make it better or easier for you?
Okay.
And that might be a simple thing like, he's going too fast. Or, I can't understand what he's saying. Or, he's appearing very aggressive. Or, he's not listening to me. There could be any one of those sort of things.
I won't get into trouble for saying like you're coming across aggressive.
No.
I won't get into trouble.
No, you're not going to get aggressive because you're not going to get into trouble. I'm sorry.
I'm not going to get aggressive.
No. I'm going to help facilitate and say, how are you feeling? Because you've got valid feelings. You've got a valid need to be able to engage. Right. This is your appointment. This is for you.
That's true.
Remember that first statement at the very beginning? I have agonizing pain every day. I need help. Yep. That's what you need, right?
Yes.
So there is a benefit in persevering.
Absolutely.
Now, look, some people can be difficult. I get that.
Yeah.
But we're going to work through. And there's also layers to that. 0 to 10. They might be down here and they might be a little bit,
they're all
a little bit annoying.
Yeah, they're all different.
We can deal with a little bit annoying.
Yeah.
Even if it's just a little bit worse than just a little bit annoying.
Afterwards I can just
But
be like...
cumulative, exactly. So you do a strategy of afterwards and you can say, hey.
Yes.
So we're going to try and get through that. All right, so we've talked about around some of the things. This is about you. This is your appointment. Your feelings are valid.
I'm going to write down deep breath.
What a great strategy.
Because I know that I'm going to be anxious.
Okay, that's a great strategy. All right.
Is breath without the E or with the E?
It can be any which way you want it to be. It's how you see it. It's actually different in
Take
different countries.
breath.
Yep.
Is it meant to
With a
have
breath.
an E?
Just with a TH.
Okay.
Okay.
All right, so I'm going to put that there.
Okay, as a reminder, no worries.
That will remind me, hopefully, of all of what we just kind of talked about.
Sure.
Of like...
Now, in part of the preparation, because it's at 12 o'clock, we're going to be ready well in advance for this appointment. We're going to be everything set up 15 minutes beforehand.
I'm going to put down my appointment to make sure that they... I don't know about other countries, guys, but our doctors are very egotistical, most of them. And like you said, the different levels of how they force that out to you. But I'm just going to put my appointment because I'm equally... like there's 50-50.
Wow.
They do 50% of consulting and I'm 50% clinical symptoms giving.
Come back to the beginning.
My appointment.
The symptoms are your
They
symptoms.
work for me.
The experience is
They're
yours.
tax-paid.
They're there to help you. Exactly. So it's actually not, it's meant to be a consultation. So they actually need to listen to your
I'm paying
experience
them.
and what things might
They
work
work
or
for
might not
me
work.
from taxation.
They're not inside your head. They're not inside your body, and they haven't had
never
the
met me
51
before.
years. Exactly. All right, so that's that part. You might want to work down that little statement I put at the very beginning. I'm in agonising pain every day. Please help me. Okay, that might be your go-to statement, just to keep you focused and thinking while you're doing that. Now,
I'm in agonising pain.
agonising, so it shows you a big word
And
that
I want
describes,
help.
it's a descriptive word, and you want help. Yeah. So that's your action statement. What am I looking for out of this appointment?
Statement.
Okay. So you've got a plan. You've gone through some of the issues and you've already got a strategy. We're going to be ready 15 minutes beforehand. That means everything is going to be done. You're going to have enough food beforehand. You've been to the toilet beforehand.
It's a good time, yeah.
Yeah, medications early beforehand as well, just in case they're running
snacks.
late. Exactly. All right, so we've got those part of things done and out of the way.
An hour?
It's an hour-long appointment. The reality, a lot of these things is they try to wrap things up in about 45 minutes, but there's actually a lot to go through. Now, if we haven't been able to get through everything because of the complexities of your condition, because you're not just a person going, hey, I've just got X.
Yeah, I'm not normal.
You've got X, Y, Z, plus a few A, B, C, Ds and everything else in between. Now, we're going to go through some of these things.
Okay.
The steps with the pain management clinic at the hospital, normally with all other specialities, you're referred from your GP or another specialist. The referral goes through the CRS, the Central Referral System. It gets assigned to a hospital, it gets assigned to a department, it gets assigned to a clinic, and it gets assigned to a particular consultant. That person then works out how much space and availability that they have, and they work out the triage of, is it critically urgent, within the next 6 weeks, level 1, is it averagely sort of urgent, 6 weeks to 3 months, or is it something which we can get in the next year? Sometimes those yearly appointments we already expand out to 18 months or more. So 3 different levels of referrals. You have been referred, and this is just a thing to actually remember. I'm going to go through a few things from an OT, a clinical nurse, your GP, a rheumatologist, okay, as well as other specialists have also identified and recognised things such as cardiology and neurology, at the very least, that you've got pain. And we're going to talk about some of those things. So you've got multiple people who are saying
I've got multiple different types of pain.
Bingo.
Too.
All right. Now, the primary person who actually referred this, Dr. Aang, he's a rheumatologist. He's a private rheumatologist outside of the public scope. He's actually referred you originally for the concept of having the conversation about accessing a thing called ketamine through an IV, intravenous, low dose, so that it's going to actually lower the pain that you're in on a regular basis. That was the original concept of why you've been referred. Now, the interesting part about ketamine is it's not a drug or a resource that they can give out at every hospital or clinic. There's only about one hospital in Perth that does provide that.
That's public.
Not the hospital that Dyan's going to.
No, but he could refer me.
If it is identified that ketamine is the way to go, then they can internally refer you and we can do it that way. So that's something just to think about in the back of your mind. Now, ketamine may not be the ideal solution. We're going to talk about the whole scope of everything in pain management, and that's why the conversation it is. So I'm going to talk about
drug interaction.
Yep, absolutely. I'm going to talk about a few things. While I'm talking about a few basic nitty-gritty, let's call them administration rubbish.
This is my next snack of the morning. I've already had.
This is the gastroparesis. You've got to have all these little snacks throughout the course of the day. And in fact, this is one of also the key things that contribute to pain is GI related. Anyway, pain management. The pain management issues associated with 22q 11.2 deletion syndrome are often stemming from orthopedic problems, gastrointestinal issues, hypercalcemia. The common orthopedic problems include scoliosis, curvature of the spine, joint pain,
didn't know that
arthritis, issues with the cervical spine, so CCI, cranial cervical instability, impingements right on the nerve, rubbing on bone, chronic constipation and impaction in the GI tract, GERD, abdominal pain are frequent gastrointestinal causes. Hypercalcemia, low calcium levels, can also lead to muscle cramps and seizures. So Dyan also has dystonia, which is an intense muscle contracture and distortion of the muscles. You've got a hypermobility connective tissue disorder, which is affecting your collagen, which causes you to sublux and dislocate on the daily basis. That causes you a lot of pain. You've got fatiguing conditions such as ME/CFS, myalgic encephalomyelitis chronic fatigue syndrome, which makes it very hard to be able to function and do things. Now then, let alone the different types of seizures, myoclonic seizures, atonic, tonic-clonic, focal aware, absent seizures. All these different seizures can have their own relative impact. Then you come back to things like Tourette's, when you've got motor tics and you've got these ballistic movements. Now sometimes those ballistic movements, apart from putting strain on the muscles and on the joint structure, you can bump, bruise, contusion, you can tear an avulsion, you can tear the skin because of the fragility of what's going on. Then you've got to look at separate parts. You've had a toe replaced, you can strain, you can have a fall injury.
Though, because mine was child size.
Bingo.
And they said children's sizes are experimental, public doesn't cover you.
Correct.
So I've got no bone in there.
100% as well.
Gap.
Now you can easily fall, particularly things like atonic seizures. You had one recently where literally, because you can't arrest yourself, you can't put your hands out to protect yourself.
I melted. into the
body
floor.
fell like a tree, and of course you're using your face as a brake. Not a good thing to do. So
That's
you can
what
break
hurt my
bones
wrist
very
too, I
easily,
reckon, 'cause that was
straining.
close to that.
Recently,
kind of
you've had
fell.
about 7 or 8 different MRIs, CT scans, ultrasounds because of the different injuries. So I'm just painting the picture that there's a lot of conditions that can contribute to pain for Don. Now, here's one of your challenges as a person with autism specifically, and that's about the interoception, the inawareness of the internal states. So, for example, with interoception, you might know if you're thirsty or hungry, whether you need to go to the toilet, whether you're overheating, or whether you're in pain, where the pain is, until it actually builds up to a very high level, right?
Yeah, I've got a high pain threshold too, so sometimes it's annoying, isn't it? Because you've got to live life, right?
Correct.
People that live with absolute pain, no matter what level, you do just get on with life. But the sad thing is, it gets to the end of the day, like people, if you don't know this type of pain, think of going to the gym. The more you do at the gym, the more pain you feel that night. It's the same as people with pain. The
Correct.
more I do all day, the more I get punished that night.
So sometimes you say things wrong in your communication because of being
do.
autistic, and that's sometimes
Hate
relate.
that.
So common scenario.
It's 1 hour.
And look, here's an example. You've gone
Because of me.
to the doctor's clinic, and the first thing he says is hello, and he asks at the same time, how are you? And you go, oh, hello, because you're using these social things or conventions, and you think I'm meant to be positive and cheerful, and go, hello, doctor. And he might ask, how are you? And you go, fine. And I look at you and I go, but she's not fine. She's had a severe migraine since 4 a.m. that morning.
But that's
She's had 6 seizures the day before.
So if you want to know the downside of ABA, that's it.
Bingo. Okay, so we'll just create a bit of a context of why some of these things are difficult. Now, I'm going to pass you a book because the process with the pain management, apart from the referral from the doctor, there needs to be an initial appointment which actually outlines, it's like an introduction, it's like a 2-hour introduction, again it was online, about how the pain management processes work at the hospital, who you're going to see, what the steps of the processes happen to be before you actually see the consultant, and how they can assist you at that stage. So that's stage 1, is an initial meeting to see if you're eligible and wanting to proceed to actually talk to the pain management clinic. That's the first thing that I had to do for
the pain
you.
doctor.
No.
Oh, you've done that.
Yeah, okay, so I've done that
I'm
one.
confused.
That's okay, and that's why we're going through these steps. So that was step number 1 that was done at the last
I'm
year.
overwhelmed already.
That's okay, and that's why we're going through this now.
No.
So that you're not overwhelmed on the day, right? See how she's starting to go,
I want to be independent.
The next part was what's known as the STEPS program. This was done over 2 days. Yep, a lot of steps, a lot of hours, and it was about listening to their psychologist, their physiotherapist, their pain consultant, and a generalised doctor as well. And it was going through the self-training, educative pain session program. Lots of information, okay, and it talks about medications and things that they can do. It talks about alternatives to medication, things that you can do, conditions.
It's to me a little bit
Have a little look at that while we're talking, please.
Well, I don't really feel I need to because I'm such a critical thinker that to me, this is all stuff that, sorry, I'm just going to say it, in psychology, us humans, Homo sapiens, are lazy, right? And also, there is things that can manage your pain that are non-drug or non-device thing. And then also, sadly, there's a lot of drug seekers.
Now,
so they have to filter that. That's
correct.
Understandable. But basically, see, things here, it's like the walking it out. Some of you might laugh at that, but I know with my back, when I wake up in the morning, my spine, because 22q spine collapses. That's why I've got CCI as well, and EDS doesn't help. But walking around a little bit, just in the house, it relieves that pain because it unlocks all of that from sleep. You bunch up.
It does, exactly
So
right.
it does sometimes walking a little bit does
Now,
help your back.
You said that, hey, it's almost pointless reading this, you know all these things already. Now,
Well, then you tell me what's in there because
I'm
that's
going to.
overwhelming.
It is overwhelming. And that's, hold on, let's slow down. 2 days worth. That's 2 days of my time that I've actually gone through and done their course because I know that you're overwhelmed. Communicatively,
it's hard.
understanding
I
the
listened
information.
in, didn't I? But I was like, whoa, this is...
But remember too, there's a difference in listening and receptive listening, understanding and comprehension around that. you can come across, and it can be very confusing to some people, maybe sometimes our audience, because you speak so well. You can speak like a psychologist because you've studied psychology as a special
But my
interest.
comprehension is...
But your comprehension of the basic things is not that you can tie your own shoelaces.
Put that down to tell him, because this is
Right.
a new doctor. He might
Now,
need to know that.
I have gone through that course to be able to filter out and work out what's very specifically relevant to Dyan, what she already has done, what things that she could do, what things that she needs to ask, and we've documented that. And that's part of why I'm now doing this conversation with Dyan, so that I can work through that information just before the appointment, so it's very fresh in her mind. So let's set the scene, let's set some other information, because sometimes these people might ask other questions, and it's important that we bring this information together, and it's also setting the context to why and what we've already done. So for example, in March last year, you had a functional capacity assessment done by an NDIS, National Disability Insurance Scheme, OT, an occupational therapist.
Yeah.
She advised that Dyan experiences chronic, severe, multifaceted pain, significantly impacting her daily function, mobility, and overall well-being. Her pain stems from 22q11.2 deletion syndrome, its associated comorbidities, including Ehlers-Danlos syndrome, fibromyalgia, dystonia, scoliosis, autonomic dysfunction, chronic infections, neuropathic pain. The clinical nurse also did an assessment and confirms that Dyan's pain is constant but fluctuates in intensity, with a baseline level of 5 out of 10 on a good day and reaches easily 8 and 9 out of 10 on high and bad days, and that's when she flatlines. Pain can also be an initiator and trigger for her going into seizures, where her body just can't take it anymore, and we've seen that happen time and time again. So you've got two supporting reports from allied healthcare professionals, occupational therapist, as well as a clinical nurse, and it's worthwhile getting that sort of information together, whether it's helping you with the NDIS or helping to understand your own needs, or to be able to communicate and engage with the health system, the medical system. Now, what are the types of pain that contribute specifically to Dyan's condition? Musculoskeletal and joint pain. So your EDS, Ehlers-Danlos syndrome, that's that hypermobility. Of course you
To
can.
that, so what I've put to... So, as I've said, my comprehension is difficult because of 22q.
Okay.
Just in case something happens and he's not
You can
slow
refer to
enough
that.
or whatever, and I'm
Okay.
like, or I've said something and he's saying, no, that's not what I asked, which happens a lot. Then I've got the words to say that now.
Okay, good.
Then I've put good day 5 out of 10 because that's correct. And then, but what I wanted to put too, because this is the specialist pain doctor, he needs to
Absolutely.
know pain.
Pain, pain, pain.
I've
Yeah.
put 6-7 out of 10 can only be managed for a few hours.
Okay, all right.
And anything above is like, please help.
Just also paint the picture, if he does say, what do you do for pain currently? So let's actually just start on that before I go into these other things. Ice, heat pack, yeah.
Creams, magnesium cream, magnesium spray.
Sure, so different types of gels, heat gels,
And then I take,
anti-inflammatory gels, Voltaren gels, so it's gels, yeah.
what else? I take gabapentin if it's nerves.
Nerve pain, gabapentin, yeah.
And if it's like this type of pain, like I'm saying here, if it's 6 to 7 out of 10
Yep.
or higher, and it's going on for too long,
Yep.
I have 2 milligrams of tramadol.
Right, so you do microdosing of tramadol drops. So before
Tramadol
that,
drops.
in the build-up, you have paracetamol for basic
Yeah,
level pain.
that's true.
It's a complementary drug. Paracetamol is a great basic pain
'cause it
relief,
does nothing.
but it complements or supplements other pain relievers to work
nothing.
together.
Yeah.
You can take Nurofen, but there's restrictions. Why can you not take it all the time?
so
Nurofen's an NSAID,
if
also
I
known as
take it
ibuprofen.
more than once a week, then I will dislocate way more.
Because you become loosey-goosey, right?
Yeah.
And you pop.
Yeah,
okay.
it hurts.
Also affects your
Then it
stomach
causes
more.
more pain. And yes,
And it's-
stomach.
right.
It's not good for my stomach
Okay.
because
Ulcerations.
oh, yeah,
Alright.
I've had like, what do they call them in the
GI tract.
GI tract? The lacerations.
Lacerations. Okay. You can't take things like codeine or Panadine Forte
No,
or
I'm
morphine.
allergic to opioid family.
Right, so there's restrictions on what you can
Yes.
take. Pethidine, all of those type, can't take it all, right? So you've got limitations that you can't take certain drugs. The other thing, so you've got Panadol, Nurofen on the middle bit, gabapentin, escalation up to tramadol drops. You can't take the 50 milligram tablets because they're too much for your body, for the tramadol. But you also take medicinal CBD THC. The THC gives you the
yeah.
pain relief,
Yeah.
but you've got
But
limitations. You cannot go above a
It's
certain
lost
threshold.
its effect on pain,
And effectiveness
but
reduction.
it just keeps my neurology calm, helps the seizures and the Tourette's and all that. But even that, like, because I can only afford half the dose I was first...
So it's a financial limitation.
Well, the doctor gave me one dose when I first went on it.
Yep.
I could only afford half of that dose, and he wants me to go up a dose.
Yeah, twice as
and
much.
I told him I can't even do that. So
Sure.
yeah,
So there's a
I
cost
can't take enough
limitation. All right.
That's
Apart from the
Make it on PBS.
non-medicated solutions, and you talked about ice and heat and creams, we also do traction, pressure pointing.
That's
deep
right. We have a massage gun that really relax the muscles
acupoints.
quick.
You've also done
Click in.
needle therapy previously, acupuncture. So you've done that previously as well.
TENS
You've
machine
used
away pass.
TENS, which is transcutaneous electronic
Seizures.
muscle stimulation.
We only tried it for Tourette's, but we're going to keep trying that.
And we obviously do reduction of joints because I can manage that
Yes.
using chiro and physio skill set. So you use
Massage,
alternatives.
yeah.
You can lay on a floor to lengthen out your back.
Yes.
You use a bath with a heat and a spa facility
Hot
and
water.
Epsom's. So there's a lot of different
Magnesium
solutions
plates.
that are used that are not just medicated. So that paints the picture so you can explain it, because he will need to know, what do I try? And it's important for him to know in levels of pain, what do you start off with? How do you build up? Do you want me to make some notes on that while I'm talking? So you do that and I'm going to talk over here. So
I can't go into Tuesday.
No, you can actually maybe use the notes section. Musculoskeletal and joint pain. So like I said, Dyan's got Ehlers-Danlos, that leads to frequent joint dislocations, chronic musculoskeletal pain, widespread connective tissue dysfunction. She has scoliosis, that's a curvature of the spine, multiple spinal impingements that contribute to persistent lower back and upper back pain, exacerbated by prolonged bed rest and muscle deconditioning. She's got TMJ, transmandibular joint dysfunction, and you'll see that a lot of the time in the dystonia with oromandibular dystonia or seizures. That results in a jaw pain, facial tightness, difficulty chewing, worsened by dystonia-related contractions. Neuropathic pain and autonomic dysfunction. So there's a chronic nerve pain manifest, which is burns, it tingles, it's numb, particularly in your legs, arms and lower back. You've also got reactivation of shingles, which comes from what bug? What virus?
Shingles is chickenpox.
Chickenpox reactivation.
3 times.
Exactly.
And then our
and that's a very intense neuropathic pain because it's the nerve endings that create pain as well. Chronic nerve pain manifests, like I said, as burning, tingling and numbness. The autonomic dysfunction related migraines, neuralgia, they're frequent, triggered by temperature changes, postural shifts and sensory overload. You've got the dystonia related pain specifically with frequent dystonic storms where involuntary muscle contractions cause severe cramping, rigidity and prolonged recovery periods. Facial, jaw and cranial dystonia leads to headaches, eye strains and difficulty with eating and speaking. Then you have the GI tract, the gastrointestinal and abdominal pain. So with gastroparesis, you've got IBS, irritable bowel syndrome, chronic infections resulting in abdominal discomfort, bloating, discomfort with the clothes that you wear, ongoing consistent nausea, wanting to throw up, GERD, reflux and sharp pains in different locations of the bowel as it goes around. She's regularly running different infections, multi-drug resistant Klebsiella, which has led to a persistent pelvic and bladder pain, severe discomfort, frequent urination, reliance on pain medication strategies. You've also got in that same sort of space, what do they call it? I'm trying to think of the name. Can't think of it. There's other names. I've got to work out the name. Circulatory and compression related pains. Full body non-pitting edema. It's painful. It's swelling. It creates stiffness at the joints. Difficulty wearing clothes. You have to wear compression garments as well. Then there's vascular issues, including venous insufficiency caused by lower limb pain and circulatory discomfort. That steps into cardiac pain, intense angina, pain that radiates around to your shoulder, goes tingling down, causes you to hyperventilate, sweat. Are you getting the point here? There's a lot of different things that contribute to that. Now, as I mentioned, she's been referred by the private rheumatologist to pain management for ketamine, to manage pain from Ehlers-Danlos and fibromyalgia. Access to pain management is a bit difficult for Dyan because of her disability, so we've had to make some accommodations through the hospital to actually be able to provide it through telehealth, and that's part of my challenge. And for Dyan to also attend like the STEPS program, how can she leave her bed, go to a hospital, sit up in a group for 2 full days, sitting up in a chair without being able to lay down, be able to go to the toilet without access to medications? These sort of things are insane. So we've had to do a lot of work to get accommodations to access this. Now, I do want to point out there's some latest research about ketamine, particularly coming out of the UK. Urology departments, and I need you to listen to this, urology departments in England and Wales have reported seeing an increase in the number of young adults with bladder inflammation associated with ketamine use. This appears to
that
coincide
sounds
with an
awful.
increase in ketamine. Ketamine can affect the bladder, causing frequent urination, nighttime urination, sudden urges, leakage, inflammation, pain in the bladder, lower back, and blood and urine.
Oh, that's
These symptoms
bad.
can be severe, make life daily very difficult, and may even become a permanent issue because of having taken that.
Okay.
Also, your
So we
doctor
have
has
to take that
concerns
into
around
account.
ketamine because it may impact on your seizures as well. So it might have a knock-on
Okay.
effect of causing
Well,
more.
I don't want anything
Right.
else to be made
So,
worse.
now, even though the rheumatologist has given that as an idea,
But he doesn't know the whole 22Q.
bingo, compartmentalisation of specialists that
they
don't
only
understand the
stick to
big
what
picture.
they focus on, which when he sees me, it's just EDS.
So do you understand now why I'm saying
Fibromyalgia.
he may have recommended that? Great concept, but it may not be suitable
Yeah,
for
he's
you.
just trying.
Cause more risk,
Yeah.
cause more pain. What's the one word that we've learnt with 22Q that all doctors need to know when we're talking about new medications? Where do we have to start?
Microdosing.
Microdosing. We have to start low and go slow. Always be very careful that Dyan might have a oppositional reaction. Paradoxical, exactly. So you need to explain that because if he's not aware,
Doxical.
yeah, just throw that word out. I love these
Is
big
that
words,
the
don't
word,
you?
paradoxical?
Yeah, it is.
So I need to be microdosed, and I have a
Start
paradoxical
low, go
effect
slow.
sometimes.
Potential paradoxical effects, which causes you to have the opposite effect
Well,
to
even
what
with
other
the
people
Tramadol
do.
drops, I have 2 milligrams.
Yeah.
And if I have 2 milligrams, like say if I had it today
Yep.
and then I had it tomorrow, on the third day I'll be vomiting.
Correct. And that causes you more
I'm
pain,
hypersensitive.
more discomfort,
Yeah.
more GI tract issues, and the loop continues. So in 22Q, we have this phrase called catch-22.
Catch-22.
Write that down because I think that's a really important one for you to remember to tell them. Catch-22 means if I fix one area over here, I could affect 3 other areas over there. So that might be great, but the knock-on effect can be debilitating or
Yeah, I
life-threatening.
don't want to like swap a problem for another problem.
Bingo. All right, so does that give you a bit more information to be able to communicate?
I've got it.
I'm now going to go through the information that I learned at
This
the
is why we do this, guys.
orientation.
Because you know what? If I went to this appointment and we don't do this, and sometimes it happens if we're too busy for some appointments and we don't do this, we mostly do,
Yeah.
then I get there, I'm like, I look to you, don't I? I'm
Exactly,
like,
because you're overwhelmed.
"What?" Yeah.
How can you
Overwhelmed.
equally participate?
But this is like, I can go, oh, hang on, I can
Right.
find it here.
Well, this is like either preparing for an exam or as
Yeah.
a team sport, you're doing all the training to get ready to be able to go out
Yeah.
on the day and
To
perform
answer
your best.
questions.
So you're
Well,
going to be able to
it's
perform your
only
best
an
tomorrow.
hour. It goes fast.
And now you've got some key things to work through in sequence to say
Yeah.
what's important for me. Starting with that
This
very
is
big
me.
Okay, great one. All right, so in the initial clinic, the orientation that was actually done,
Right.
this was an orientation to pain. What are the things? I met a Mr. Cal Graham. He's a clinical psychologist there. That was a 2.5 hour session for the orientation. They do a referral to the pain meds unit. The online meeting indicates that the referral has been processed. It's not an individual session. It's all about group information to start off with. They provide a link for a form, and this is where information on your personal pain specifics are available. Then we submit the form as an opt-in to say, yes, we want to come along to the clinic. Now, we've done all that at the very, very beginning, back in
Yeah,
April
some
last
of the
year.
stuff they do is correct. I do distraction.
Yep.
Oh, I should put that
Put
down.
that down, that's okay.
I do the thing like distraction. I listen to music and sing, or I'll do an activity that takes my brain away from thinking of the pain.
Correct.
It does work.
Note those things down. Note those simple
Looking
things.
at, like, I'll
Yep.
put on one of my nice lights or candles and I can stare at it
Yep.
and just switch off from the pain.
Perfect. Now, some of the
Distraction.
things in this clinic were above Dyan's capability to really be able to participate and be able to action. Now, this is why we have in our relationship an EPG, an enduring power of guardianship. That's very medical specific as the role to be able to help Dyan to be able to navigate through, to be able to attend in person, to be able to also make medical decisions for her best interest, because Dyan can be overwhelmed, can be confused, may not understand, or may not be able to participate at the speed that a lot of these clinics and appointments do. The form can also be very overwhelming, and there's a lot of information that we have to actually know and be able to compile. That's again my role. This is why it takes me many, many hours, hundreds if not thousands of hours, to look after Dyan overall within both the disability and the hospital sections. Now there is a broad spectrum, wide range that needs to be covered for Dyan. Chronic pain is complex. The service is a multidisciplinary approach. There's a pain specialist, a psychologist, an OT, a physio. Chronic pain isn't just acute pain that just kept going. And in fact, things like endocrine inflammation changes, that creates new issues which are treated treatment resistant. In every case, there are multiple causes or inputs that causes pain. It can affect all areas of a person's life. Existing treatments tend to have a limited impact. Treatment works better when more inputs are addressed. So we've got to identify what are all the things that cause other inputs towards Dyan's pain. And that's why at the very beginning of this conversation, we've identified those things so that we know that all of these things together input and cause pain in her body. And it may not be one thing that just becomes the buzzword. But even with ketamine, I've got to say, just because you suddenly get a relief from ketamine, you have to actually keep increasing the dosages as you go along, a bit like you found with medicinal CBD.
Yeah.
And that becomes harder.
As much as I don't want to be in pain.
And then addictions also come into play as well.
And as much as I really want to get some pain relief, I don't like drugs, which prescription, street drugs, they're all the same. I don't like putting that stuff in my system if I don't have to. So I'm very, very conscious of, if it's necessary, it's necessary. If I can go without, I try. But so this is a hard one because I am in agony. But I don't like this addictive thing. Or
100%. And you actually refuse medications if you can. Now, here's a very important point that we have to actually make, which is a bit of a reinforcement loop back into the overall system of health in Western Australia. This compartmentalisation, the lack of awareness for the complexity of Dyan's genetic condition 22q, a lack of specialists actually understanding, because remember, there are no adult specialists in all of Australia. The UK's got the same issue for 22q. There are 2 children's clinics, but Dyan can't go backwards to the children's clinic in the Medicare system. It doesn't work that way. Once you're 18 and above, you have to be in the adult space. Now, the reason I'm saying this is the causation, or the word inputs, which they use in their language. I'm teaching you the language that they might use. Inputs. What contributes to you having pain? It's a multidisciplinary approach.
And one of
our biggest issues, Dyan, is the fact that all areas, all specialists need to step up and help you. So, if for example a cardiologist doesn't help you with chest pain, you then have a knock-on effect where respiratory, you don't get enough oxygen, you have more cardiac pain, and you then lead to more seizures. If your neurologist doesn't help you with dystonia or Tourette's or seizures, you have more impact and muscle pain. Exactly. If your gastroenterologist doesn't help you with your dysmotility of your GI tract, you have to need more medications that cause you more pain and cause you more arrhythmias. It knocks on. If the neurosurgeon can't help you with your CCI and give you cortisone or surgery, then you become debilitated. And that means you'll become less and less able to get outside the door, to participate in life.
Imagine if they
to have a reduction in quality of life.
To be able to be more physically active.
What we have to do is get these guys, the pain management clinic has to be part of the push to say, guys, internally, you need to communicate to each of the other specialists. Yes, you will. But what I'm saying is, they have to be asked, you need to communicate Dyan's issues with the inputs to the various specialities that I just mentioned, because without their involvement, how do you get the inputs fixed so that the pain is addressed? So let's talk about some of these things. A lot of treatments won't work, can't work unless the inputs are addressed. That's called causation.
Sounds logical.
Now, could be some damage, there's nerve irritation, infection, inflammation. The brain, it decides if there is a threat, an effect on the immune system, nervous system, hormone systems. They're going to respond And that's why you have these pain responses.
Yeah.
The immune system response increases nerve sensitivity via changes in the glial cells, and this amplifies your pain, increasing nerve sensitivity. Once chronic pain is present, anything that puts work or duress on us is now treated as a threat by the body and causes more pain to increase. Pain's a warning. Pain is saying to your body, stop what you're doing. Pain is saying, you need to fix this, because if you don't, you're going to keep hurting yourself.
I keep thinking.
Pain is a message to say, do something about it.
But that's what I keep thinking. It's like, why don't you fix it and then we don't need the pain?
Right. So can you come back, take that logic in, put that note, because if I can't fix what causes my pain, I'm going to be in pain. So I do need the support and assistance of all these other areas of speciality to understand 22q.
I'm going to put that as a priority.
Interplay. It is a priority, right?
So I've got fixed pain priority.
Yeah. So
Can I
this
just have a fruition break?
absolutely toilet break. Here we go. Right, Diane's got herself wrapped up in a hot pack because she's dealing with pain from the GI tract running. Isn't it appropriate conversation? Now, there are things in everyday life, just doing work, exercise, normal daily activities,
great.
even stress can increase pain volume. Now, the system treats these loads as more injury, and chronic pain has multiple inputs. The issues amplifying the pain must be managed as actively as the original injury. So, by reducing the amplifying inputs, the medical interventions are more likely to have an impact, right? So, we need to appropriately manage 22q condition and symptoms. That's the big takeaway. You've got enough basic notes there to get yourself prepared and ready for the meeting. I'm going to go through to some more specifics.
I'll be overwhelmed.
Yeah. We've just been through the orientation to pain services, that's the OPS. We have gone through the submission of the form, the EPOC online form for outline. We've gone through these steps, that's what is and how to manage chronic pain. That's a 2-day Teams meeting with a psychologist, an OT, and a physiotherapist and a pain fellow. Now, we're up to the individual medical follow-up. This is really where they can refer you to things. So I'm going to tell you some of the things that they can refer you. Hydro program, a hydrotherapy program. Did you know that your hospital that you go to is actually got a hydrotherapy pool? When I asked about 6 different specialists at your hospital, they weren't even aware that even exists or how to do a referral. So these guys can do a referral to the hydrotherapy program safely. The cardiologist couldn't do so, but these guys can, so that you can actually build up strength without putting weight-bearing pressure on, and they've got a team around you who are medically trained to deal with emergencies like myself.
I'm in a hospital.
Yep, absolutely. There's the PUMP program, which is Pain Understanding Management program. That's 15 half days over 5 weeks. Is there a
wet device like this?
No. I've been looking at some sort of device that Dyan could wear in and under the water, fully submerged, that will manage her for pacing. Haven't been able to find one, so if you guys find one, let me know. So they might talk about the PUMP program. That's a group program. It goes over 15 half days over 5 weeks with a psych, a physio, OT and a pain fellow. There's always outpatient direct, the pain specialist. Everyone's pain is unique and personalised. Everybody's different, okay? Everybody brings together a whole range of things.
I just put down pacing, because I do pacing,
good.
So I don't feel so much pain that night. I do that.
Now, there are healthcare providers that do chronic pain. There's community, which is self-funded. There's multidisciplinary practices, which is self-funded. Medicare covers partially, or there's allied health. Here are your options: attitudes, beliefs, behavioural strategies, neuroeducation, neuroceuticals, medications, procedures. So you could have surgery. So, for example, your neck initially might require, obviously, injections, which are cortisone. You've already got things such as the soft collar, and you've also got things such as a hard collar. You might need you're waiting for neurosurgeons to have a look at, you might need to get to surgery at some point progressively.
First.
Exactly, so there is a progression.
It doesn't matter what injury, how bad it is. That's just the process.
Unpack. We got to look at pain, anxiety, stress, threat, worry, mood, conflict, unhelpful thoughts, unhelpful people. I like that one.
I'm not moody though, and I'm not...
But did you hear what I said? Unhelpful people. So, for example, you have had people around you who keep pushing you when you can't manage your own
when I say to them,
pacing,
I need to lay down, my neck is like been up too long, it's really sore. They're like, oh no, let's just sit outside, and it's like, but I can't because I've got what do you call these pillows? Like, I guess it's a physio type pillow.
It is a physio contour pillow.
It contours into your neck, and I have to lie down to a certain inclinement, whatever, to get pain relief and to get the strength back. in my neck.
But if you can identify those sort of things that we just talked about, that sometimes that other people put and impose upon you things that you can't do.
Well, there's expectations in society, isn't
100%.
there? Yeah.
And it's a bit like us also trying to get accommodations from the hospital themselves so that you don't have to attend. So a simple one would be, you get yourself into pain having to go and see the dietitian, for example, when the dietitian herself has said, I'm happy to do a phone call, but it's the higher-ups in the hospital that says, no, I need you here in person. But wouldn't a phone call be simpler? Cause you less pain?
Human rights
So
thing,
there's behaviours around that, but these are the sort of things, if we can identify what actually causes it, then we can help you. Your GP is always still going to be the primary coordinator for care in the system. They are the ones who will do the referrals because they actually in the scripts for medication.
Who, the pain doctor?
So the pain doctor talks to the GP, the GP manages you. The GP writes the scripts, the GP writes the referrals. Okay?
Well, that makes sense. It's easier for all
100%.
of us. Him and us.
Now, we've got some challenges though. There are some things that are not on the PBS. The PBS is a pharmaceutical benefit scheme.
But if the specialist gives you the script, then it's cheaper.
But some things aren't. So they're still
the
saying very clearly.
A lot of PBS guys.
Bingo.
It's
now,
not okay.
For people like Dyan, who's on a disability support pension,
not my fault.
doesn't have a salary coming in, she can't afford things that are not PBS. So when things are off script, off the PBS,
most are.
She pays out of pocket. As an example, her medicinal CBD could be $145 just for a single bottle.
$155.
It used to be $185. Before that, it used to be $225.
No, it's $155.
So it's gone down progressively.
And the melatonin is $75.
75. Yep. Clonazepam is 45.
And my ADHD medication is $94.
Yes. So you can suddenly
and
start
then
to see all these.
all the other prescription medicines.
It's too much. It's too expensive.
And Panadol.
So they point out with these conversations, and we have to say PBS. We have to find things that are accessible for Dyan to be able to get. Pain procedures, they can do things like radio frequency neurototomies, they can do caudal epidural injections, they can do steroid injections, which is what you're about to have on your neck.
As long as they're not bad doctors and they know what they're doing.
Sympathetic pain blocks, so we can actually block a pain nerve to say, hey, stop sending pain down that particular trigeminal nerve so that it doesn't actually affect that joint.
Would you injure it more because they're doing that? So if you can't feel the pain is a signal.
That is actually a very good comment.
I get really concerned with my neck because my neck is going to keep collapsing because 22 spines collapse. That includes the neck.
If, for example,
my concern is that the more injections I get, the more I'll just use it and damage more.
Right, so it does depend on what type of injection we're talking about. If it's a neural block, and you're actually blocking the pain receptors, then yes, you could actually damage that joint and then you're doing permanent damage, which leads it. But you're having cortisone injections, which are anti-inflammatory based. That's not going to cause that.
And it's only anti-inflammatory in that one spot, right?
Targeted right to the millimetre.
What if I dislocate my neck?
When?
Or what if maybe I need to consult with EDS as if they've ever done it?
Not for the what are you talking about now?
Well, my neck. When I used to go to, I had it for 12 years. I had the same chiropractor.
Yes.
He does chiropractic care on horses.
He does fantastic. And koalas. Keep going.
He lives in the hills.
Okay, keep going.
Him and his wife.
Refocus your conversation. What's your question?
Basically, he used to joke with me and he'd do my neck because that's how my migraines were managed too. And he'd go, oh my gosh, you're the exorcist. And I'm like, huh. Because he's like, you make me nervous, you're very flexible.
Yes, because you're hypermobile.
Okay, but if I'm got something in there,
no, that's not what it's going to do.
Like my anti-inflammatories and I dislocate.
No, it doesn't do that. That's not what it's doing. So it's reducing the inflammation around the particular joint structure of the bone to stop the grating.
Nervous.
So no, again, you're rationalising fears, which is great, and we're talking about the science. That sort of thing will not cause
just
what you're thinking. So that's really good that you're doing that.
I don't want my head to go.
Now, if it's very simple procedures, they will refer back to the GP to simply arrange that.
They also.
Yes, they actually have. They actually work with a lot of patients with chronic fatigue, earlost-down loss, gastroparesis, people with dystonia, people with seizures. So they've got that wealth of experience, which is really cool.
Glad.
What they don't do is they don't do reports for things like the NDIS or aged care or medical legal. We don't need medical legal, but in the NDIS, sometimes they ask you, oh, can I have a report from this doctor? No, well, they've got to take it from the GP. Pain specialists don't do reports, okay?
That's weird though.
Well, they're time poor. They've worked out as an organisation that they don't have enough resources, so they're cutting back to try and do the main things that are really important. Having conversations to get you access to the things that will hopefully help you. There's been a change in opioid prescribing. Well, it's not going to affect you because you know what? You don't take opioids. But for everybody else, there's a 12-month PBS review by a second GP. There's always oversight to prevent what's going on as far as addictions, basically. You've studied addictions.
I studied addictions. I mean, it comes from like the Vietnam War. They gave them opioids to keep them happy. They knew that they were abusing them. And the sad thing was, you know, it's because they knew that they put these men in such a horrific situation. And an opioid crisis came out of all of those Vietnam vets. And they battled with addictions, whether it was, maybe it wasn't opioids when they came home, might have been alcohol or something, but they struggled. And then doctors also created a dependency because they were just giving it out like lollies, and it's just really sad. So I'm glad they're fixing the opioid crisis.
Yes, I agree.
It's dangerous, and you know,
other generations of drugs that are now doing those same things. There's a lot of in the community drugs, which are non-prescribed medication that people are relying upon, and alcohol, as you say, simply to mask symptoms of pain. And a lot of autistics struggle with understanding that as well, to be honest.
Because different personalities will do different things.
Yeah.
Like, I'm someone that would never take drugs.
No.
Like, you know, I'm just, I guess, a goody two-shoes as an autistic.
Sure.
And so no matter how much pain, I'd go to medical.
Sure. Now, they're trying to encourage you to understand.
But I know people self-medicate, and I kind of understand.
I get it. So they're trying to, as an organisation, as a clinic, a pain clinic, they're trying to get you to understand your pain. Our key point is that's actually not that easy to do in your case, being autistic with interoception. Okay? And also a multi-field. Which part is actually the one causing the pain today? Is it the dystonia? Is it the Tourette's? Is it the seizures? Is it this? The list goes on and on and on. They only support atypical opioids. That's the first generation ones. They're less likely to cause addictions. So we're not worried about those. We need to talk about different types of drugs. Tramadol and IR Max, Bifrenone or Tapinol, there's different names. They're replacing benzodiazepines because they've led to increased spasms. So there's different recommendations of Orfadrine or Forflex and Clonidine, which comes out of America. We've done a research where Clonidine is quite commonly used for patients with Tourette's, with dystonia, with seizures, with other types of very similar neurological conditions as yourself as well. So we're going to have these conversations. Even the melatonin is also commonly used in this field, and you already have melatonin as part of
but I'm on a high dose because I've got calcification of the pituitary gland.
Now, for those people that do take opioids, remember that they are an immune suppression as well. There's a high level of risks and crises.
That's bad. Be careful if you've got immune problems and you take opioids.
Here's the key takeaway. You are the expert of your own body, what you experience in regards to pain.
I am.
Okay? So that's something to really do. So we're going to go through some of these things. You're going to talk about your chemical sensitivities and allergies. So you've got to be mindful of that. They're used to dealing with patients, and they're used to patients who've got all of these complexities.
Like I said, two drops of Tramadol, and then the next day 2 drops of Tramadol. The third day I could be throwing up.
100%.
That's how sensitive my body is.
Correct. Now, there is a lot of information.
I mean, even when I had hyperemesis gravidian, and I had the same doctor, and he's like, I'll meet you at the hospital. We were not in the city. And we're like, okay. And I went down because I was throwing up when you throw up for 24 hours and you can't stop, you've got to go in. And I was in and out of hospital for the first trimester of each child. And this is my second child. And I went in because I couldn't keep anything down for 24 hours. Went in and as soon as we went through the emergency, and this is like straight away they can see you, he literally looked at me in the wheelchair, that you'd grab the wheelchair to take me in, because that's how debilitating it was, and he just jabbed in. And I remember him saying, that's only 1 mil, and I was like, boom. And when I woke up, he was sitting in the room and he's like, we've got to have a serious talk. And I was like, okay. But anyway, it's like, you're never having pethidine again.
No.
And number 2, you can't have children, they'll kill you.
Yes, exactly. They will.
They really are killing me.
They are aliens in your body. Now, there's some interesting takeaways as we start to wrap this up, because it's been an interesting conversation in preparation for the stories, the Autistics, social stories around preparing you for tomorrow's meeting or appointment. Pacing is one of the things that they'll talk to you about as well.
I've got it here.
Now, I actually would like to say,
I do that.
I want a medical doctor's certificate to say that you need to pace, LOL. And the reason why I say that is that pacing works exceptionally well for you, but it's actually getting other people to allow you to pace.
Yes.
That also includes other specialists, clinics, the hospital, balancing schedules, balancing your ability to...
doctors, man.
Exactly. And we need to educate people about the benefit of pacing at the end of the day. 100%. Now, ED is not a pathway for a lot of autistics. Like it's certainly not good for people with 22q because it encompasses fear and anxiety.
That's an acute place.
Presenting to ED is a sensory nightmare, anxiety-inducing. You're already in pain. That's why you're attending ED. And you're judged differently because it's not understood what it is that you're suffering from because of the complexity of it. So we need to also understand that there's interoception, anaxophemia, all these other things that come to it all.
Beeping, even if I've got my headsets from the beginning, guys, I can only handle it for so long.
Correct.
And then I start to go into shutdown, meltdown, and then you get judged. Because autistics that can speak, apparently you're not really autistic. It's like,
Now they do talk about things such as mindfulness, progressive muscle relaxation,
well, I don't
breathing,
do mindfulness. I do craft, art, prayer. I read my Bible. I don't do mindfulness. That's. I'm not a
yoga.
What do they call it?
Buddhist monk.
I'm not a Buddhist. I'm a Catholic. So I'd rather pick up my Bibles.
Okay. So look, one of the other things is whatever medications that they prescribe, will they have impacts on your seizures or other parts of your body? So that's something
of my eplum or seizures in general.
Correct, and the interplay between all of those. So that's probably going to be our biggest sort of thing to actually have to deal with. You've tried some
ADHD, no?
Yeah, ADHD. Something's been triggered.
Anything affect that?
Yes, there's some effects that come across that as well.
Because the gabapentin makes my ADHD crap.
Correct.
That's why I don't take it every day.
Yeah, but gabapentin is a good medication for certain types of pain.
Oh, yeah.
You've tried PEA before, palmitoylphenophenamide.
Very good.
It was well tolerated, no side effects. It's very helpful for neuropathic pain, headache.
In the second month, I was suicidal.
Yes, it has a knock-on effect for certain types of...
I'm chippy.
Yeah, and that's that thing about saying for certain types of patients, the paradoxical effect, that's where it's actually not actually a good thing to have.
I've never been on an antidepressant before in my life, and I said to the doctor, it's making me more depressed. He goes, no, it can't be. I said, it is. So take me off it.
100%.
And he's like, okay, this is how you taper off it. And I was like, this shit is bad. Look, if it works for you, that's great. But I'm saying I found it like negative.
Yep.
So I use behavioural. So if I ever have a patch of depression in my life, or normally it's due to circumstances for me, then I use behavioural.
Now you've also tried LDN, low dose naltrexone, before. I have. And again, same sort of things. Unfortunately, is a depressive side effect.
It makes you depressed.
Yeah, 100%. So you have tried a lot of the things that they might be suggesting to you.
No.
And we're going to have to actually say, well, no, some of these things have oppositional or paradoxical effects.
They're going to say,
some of these things at very low level work. No, well, there's certain types of medications that do, and we have to really narrow that down. So that's the summary. You've got a lot of preparation done for tomorrow. We've got an understanding, your notes, you feel organised.
Look at this,
that. She is so prepared over here. Look at all this.
Look at my notes.
You've even drawn little pictures. What are the little circles mean? You've been doodling.
I do.
She's been doodling. Guys, I hope you've enjoyed today's conversation. This is a social story preparation so that Dyan can feel part of her own appointment.
It makes it so
prepared,
much easier.
knowing what to ask or what to expect.
I won't be non-verbal.
You'll be able to participate, and you've also got some strategies to help you facilitate better engagement, participation, and just to say slow things down if it becomes a little bit too over the top for you. Okay, that's important.
Guys, if you're like me and you're fine in your own home because there's the people that know you can speak on your level, But when you go out there, like Tony Atwood says, you're way
He's
more
the clinical
autistic
psychologist that specialises in
because
female autism in
others
Australia.
don't come to you as
At
an
your level.
autistic, right? So when things get tough, your person, your carer, whoever that may be for you, will help you. But I do recommend to be part of it too, because we want to be, you know, I always believe in, no matter what your disability is, you've got to be part of your own, like, things in life.
Yep.
You've got to be, you know, part of every responsibility and, you know, creating your own, like, life, and it includes, like, fun as well as, well, not just the you know, budgeting and all this, but this is important.
Absolutely.
And if I didn't do this, I wouldn't be able to participate.
No.
So I have to do this. Yes, it's extra work. Look how long it takes.
It's like preparing for an exam. Exactly. But
this is what we do all the time.
this is what helps to facilitate Dyan's participation.
Maybe it's a little bit extra long because it's a new doctor, but this is what happens. Just do it. Just try it for yourself if you have difficulties in communication with autism.
100%. Please also remember that pain is a whole person experience. It affects their general health, ability to work,
make
income,
you
travel,
irritable.
relationships, all aspects of life. We often need the help of a team of people or healthcare professionals.
What's the sign? The sign is irritability.
Treat the big picture. And you're right, pain is an unpleasant emotional experience. In fact, half of patients with chronic pain will suffer with anxiety or depression. 90% will have disturbed sleep. It has an impact on sleep. How many nights are we waking up and I'm spending 3 or 4 hours in the night just massaging you, trying to get you to be able to relax, calming you down,
And I'm
doing all of
just
those
crying,
strategies.
crying in
People
pain.
with chronic pain can easily overdo exercise and become exhausted, disheartened, and then avoid further exercise and get even more unfit. It's a vicious cycle.
frustrating.
Pacing is so important just to build up that stamina. So
It is complex.
it is
isn't
complex.
Well,
and that's why it's called
actually-
complex pain, right?
It's complex when you're someone that's not just, oh, I did my shoulder, I broke my shoulder,
Yeah.
or you dislocated it and I need treatment.
Yeah.
This is like, for me, a full body because I have 22Q.
Correct.
So, and I'm 51. So my body's an 80-year-old. So this is why this one for me is quite
For patients with
intense.
22Q, as Don just said, even though she's 51 chronologically in age, you're literally presenting your body with the symptoms as an 80-year-old.
Body's 80, mine's
when you
18.
went to that chiro that you were talking about, only when you're in your early 20s, and you're saying you've got the neck and the skeletal issues of a 50-year-old.
Yeah,
How is that
after my
possible?
car accident,
Well,
yeah.
you know what? It's not just that. It's because of 22Q.
Yeah, he goes,
It
I've
is the
never seen
scoliosis.
someone
It is the
your
deterioration.
age with the neck that looks like a 50-year-old, and I'm like,
That's when she was 20. So it does put it into perspective. It does show up in the
I went to
X-rays and the
denial.
MRIs and the CTs.
But I've
Guys,
always had a sore neck.
thank you so much for bearing with us and going through this process
Thank
together.
you.
I hope it's been a bit of an insight
I hope
as to
it
what
helps.
we do from the social
This is
story.
why we're sharing it.
And even
This
just
is
the
a
conversational
social
pain.
story.
Yeah.
Now, social stories, you can add this to medical appointments, to family functions, to friendship functions, to community group activities you might be doing, to when you need to talk to your support coordinator or anything, guys.
Yeah.
Like, I know that because we can speak, we sometimes get a bit, I've got it, and then we fail.
Yeah.
Just, it's okay.
Yeah, or
to say,
things
no,
like
I do
this
need help.
become a little bit too overwhelming. Trying to attend a 2-day
do
full
that.
courses to actually participate,
Yeah.
comprehend, that's too much. So sometimes you need the supports, the care
I
of
was
the
in my
guardian
20s,
to be able to participate and interpret for them.
In my 20s, early 30s, because mine's degenerative, I would have done a bit better at this.
I agree.
Yeah.
Absolutely.
But my age now and the damage to my brain
Hmm.
from seizures,
Well, we've got you stacked, packed and racked all ready
We're
for
ready.
tomorrow. That is so good. Let's hope it's a good day. Of
hate
course,
medical
if
appointments,
for some
though.
reason there's an emergency medical thing issue just before the appointment, it might need to be cancelled or
let's not talk about
postponed.
that.
There's things that
That
can
would be
happen, but we're
annoying.
flexible. Guys, a big thumbs up. I
I'll
hope
be
you enjoyed
resting.
today's conversation around social stories and preparation for chronic pain,
Highly
and management with a
recommend
pain specialist. If you have comments, questions,
when
ideas,
he
or suggestions
made me
yourself,
do them,
let me have it.
from the
All right.
when you made me do these, when I started them with the speech therapist, I was
Yeah.
like, nah.
And how do I go for you now?
You guys are just being so dramatic, and now I'm like, I really do need this.
Yeah, you really like, please, can we
it's
do this?
It's
Yeah.
improved my life. So, guys, just
Great feedback.
Do it.
Appreciate that. Hype the channel so it can actually be found. It helps us to be seen and spread the word. Don't forget to share us to others who might actually benefit. And if you're new, don't forget to subscribe and hit that notification bell. Remember, we are not medical professionals, so any of the conversations in here are not from me as a medical person to say, hey, this is general conversation about what we're dealing with. Go and see your own GP to get a referral to a pain management specialist and have a conversation with them today. Thanks very much for watching, and we'll see you in another episode. Bye for now.
Bye.